here. So we're going to do a little dry needling. I'm going to do it right along the tendon itself here. That's my wife. So we're going to work right in this area here, and I'm going to kind of go at an angle, and we're going to get into the tendon and the sheath itself a little bit right through here. This is a chronic condition. We're going to use these Myotech dry needles right here. So dry needling is a great technique. Don't miss me too much. So dry needling, I was trained by Structure and Function. Jen Allen, who is an excellent clinician, Sue Falsone's group and stuff like that. She's an excellent instructor up in New Hampshire. So in New York State, therapists can't do this in the clinic. Friends can needle friends all we want to. So we have a little fun here. So and I've been trained extensively from the cervical to the hand. Pennsylvania, every state has a little bit of different practice act a little bit right here. So there's different types of needles here, and so these are basically like acupuncture needles. And so there's a couple different philosophies, pain theories, and thoughts and stuff like that about dry needling. So this is kind of what the needle looks like right there. Kind of comes through there, and they're sterile, they're clean, and so we just kind of pop that in there, and it goes in. They're very fine, very thin. The hand is definitely a more sensitive area to get these in here, especially when you have real thick, hard skin and stuff like that, like Jed's got right here. So, but these turn out usually, they do very, very well. So, we're going to go ahead and get ready to get Jed going here. So I'm going to run right along at an angle, and I'm going to try to get myself down into this tendon here. Sorry, Jed.
No, it's okay.
So, and then we're going to come across here. Tell me if it's too much. Right there.
It's triggering a response.
All right. You can come a little bit farther over
I don't know if it's too much, Jim. It's just,
Yeah. The hand is a very sensitive area. And he's going to remain still with this. You tell me if it's too much, don't move. Okay, we're going to keep there. And so usually right around...
Well, that's very callous right there.
Yeah, and I'm going to stay away from that. Right on this outside edge here. Tell me it's too much. And usually there's like a 3 to 5 centimeter overlap where you'll feel this. These are a little bit, they're the thinness that I need, but they're a little bit longer needle than I... You doing okay so far?
Doing okay.
Right there. Okay, let's just take a look. So we're going to leave that there just for a second here. We're just going to let it sit. And usually we do an in and out. You can piston. You can do what you want. This is, like I said, sensitive area. I might try to go a little bit more on this one right here. Tell me if it's too much. Okay, right there.
Good.
I'm going to go here. A little too much. Is that okay with you?
It's fine. Yep.
Okay.
Yep.
All right, a little bit more right here.
No problem.
Okay, a little right there. Okay, so we're just gonna let that sit. So we've probably got about a 1/4 of an inch right there or so into the tissue, whatever, and so we're just gonna let that sit for a second. He's not gonna move. The time this is different than acupuncture. The philosophy's different. The techniques are different. We're looking at myofascial trigger points with this right here. Both are very effective. Acupuncture is great. Dry needling for myofascial trigger points and adhesions, and that's what we're kind of trying to get into right now, trying to increase some blood flow and those types of things in those particular areas. And then we'll pull these out in just a second, and then we'll get him started doing a little movement again and see how he does with this.
Okay.
Give it a little time. So I'm going to get ready to take those out. So here we go. And sometimes you get a little bit of a bleeder, but put them right in the...
Dude, I think that exact same spot.
Was it the last spot last time?
Bled there last time too,
Yeah.
and nothing else did.
Alright, and
It really doesn't feel that bad. I know I'm making faces. It's more like an anxious.
Yeah.
So
I remember the first time I had a needle put in my quad, and it was just a small needle. Jen put it in my leg up in New Hampshire, and I about passed out. And it was just this little, like, man, by the end of the weekend, though, we were using 2-inch needles, and not, it was going great. So.
pounding nails.
Oh
with
man!
a hammer.
Oh, I had like 15 needles in my shoulder girdle like at one time. I didn't even know they were in there. It was awesome. Yeah.
That's cool.
So relax for me. So we got some great passive motion right there.
Wow.
Put your elbow on the table for me. Let's go back here and let's see. Relax now for me. Let's see if we can do a little bit better passive stretch. Can we get a nicer passive stretch right there?
There's zero pain
That's
whatsoever.
Good. So and usually to get that good viscoelastic stretch of the soft tissue between 30 and 40 seconds is where you want to start with that. That's where you start making some changes. A little longer than you can, but I can. That was me. All right, so let's see. Just kind of open and close that hand for us a little bit now. I needed my glasses so I can see.
I can't even believe I'm able to touch my fingertips to my callus line.
Oh, look at that. Is that what you had a hard time with that before?
Mm-hmm.
That's good. I just think we needed a little extra on that. I was a little light last time. I wanted to see how you were doing because it wouldn't be it would be a week or two before we got a hold of you again.
Yeah. I can't believe that.
So good. I think we're going to be okay with that. I think we're on the right path.
Mm-hmm.
So we'll see how this
I
goes.
feel like when I make a fist, like the fingers are all in proper alignment.
Oh yeah, yeah.
Versus the middle finger being popped up.
It's tracking well. It should be down the distal palmar crease, and they all should point towards the corner of the scaphoid right here. So that's good.
Now when I bring here and extend, there's no register at all on the extension.
Okay.
If I go here and then allow a little bit more into the palm.
Yeah. That's where you feel
One time I got like trigger point type of.
That's where you're. So you think about that. That's where you're winding that tendon up. It's really that excursion is really putting a lot of force into those pulleys into there.
Okay.
So
but it hasn't done it again.
Yeah. So I think, and that's kind of why the therapist, what we'll do is we'll block a joint, and some of those that are really aggressive and painful, we'll block a joint so it'll decrease the excursion to that pulley system, and it won't put so much pressure on the inside of that. So
normally day to day, just doing like this hurts.
Yeah.
Yeah. This is pain free.
Oh, good.
And day to day, doing this, it catches like every single time.
Yeah.
And now it's not catching at all.
Yeah. So I think maybe between the manual therapy, stretching that out a little bit like that, opening that up, instrument assisted, doing some of that cupping, getting that moving, and doing some mechanical, getting a mechanical stimulus in there for the with the dry needling. I think we're going to get on things. So.
Yeah. I mean, I can't believe it.
Good.
The change this time, I would say, is probably
way different than the last time.
5 times better.
I think because we spent a little more time up here a little bit at the same time too. I definitely was able to sink deeper into that hand this time. Like this one, the second time around, I popped that down through a little bit. I got a little bit beforehand, but this time I got down a little farther. So I think this is going to be the ticket for us. So.